Hey, so sometimes this question comes up. If you're losing a retirement plan from an old job, does Medicare start automatically? We're going to be covering that in detail today in today's video. Stick around, I'll be right back. So if you are losing a retirement plan coverage from a retirement situation, you've retired, you have retirement insurance, does Medicare automatically just take over when you lose your retirement coverage? I'm going to explain exactly what happens in a retirement plan and typically what has happened with your original Medicare in this process. So one, if you were turning 65 and you're enrolled into an employer group plan and you're retiring onto retirement insurance, typically you're going to enroll into Medicare Part A and Part B. You're going to qualify for Part A and Part B 3 months prior, the month of, and 3 months after. That's called your initial enrollment period. And what's going to happen is you're enrolling into Medicare, and then you're going to be having Medicare in your first payer position. And then your retirement plan, if your group retirement plan has had 20 employees or larger, you can stay on the retirement plan of your choice, and that would go into second payer position. So Medicare would be the first payer, the second payer would be your retirement plan. Now, what happens when the retirement plans, and we are seeing this historically, we saw back several years ago, Tennessee Valley Authority, who had a huge contract with Blue Cross Blue Shield, they dropped about 500,000 retirees. Catamaran was the Part D coverage. And my dad was actually a recipient of getting notification by mail saying that he was losing his retirement plan. Now, he had a Medicare Supplement with Blue Cross Blue Shield at the time, and he paid very small premium, like $70-something, $60-something a month, and it covered, as a Plan A, it covered 100% of what Medicare Part A and Part B did not cover. So he was a retiree from TVA with a retirement plan. His Catamaran drug plan, because he had emphysema, and he's passed away now, so I'm sharing this information post-death, so just hold tight. But his Catamaran Part D was incredible. He didn't pay anything. It was part of the retirement benefit. And his inhalers that he used, he had like 2 or 3 different inhalers that he used daily, were only like $5, $10 copays for refills per month, which is amazing. So what happened to him when his retirement plan, and he was notified that it was going away? Well, one, the first payer is Medicare. The second payer was retirement coverage. His retirement coverage is going away. So what replaces that? Well, nothing replaces that. So what happens when a retirement plan falls off and your first payer position is Medicare? Well, pretty simple. You are going to have Part A deductibles, which right now is a little over $1,700. And then after so many days with Part A services, if you're staying in the hospital up to 150 days or longer, you're going to pay 100% of the cost beyond that on original Medicare. But up to 150 days, after 60 days, 61 through 90, you have a cost per day. And then 91 through 150, you're going to have a higher cost per day. And you're going to use up what they call lifetime reserve days during that process of 60 days. So what does that mean? On Part A coverage, you have a catastrophic event and you're in the hospital a long period of time, you're going to end up owing a lot of money, one. But typically, most people that go into the hospital and stay an average of 2 days every 4 years, that's kind of the national average, you're going to have a little over $1,700 deductible. Now, what happens in the situation if a doctor outside of the hospital comes in and works on you? Well, guess what? A specialist works outside of the hospital. They're going to bill through Medicare Part B. You're going to pay the Part B deductible of that year, and then you're going to pay 20% of the billable rate for fee-for-service for that doctor. And it could be several thousands of dollars. So in first payer position, what would happen with your additional insurance? A lot of times it would pick up almost all the coverage. For my dad, he was paying like $60, $70, $80 a month for a supplement, and he would have no Part A deductible, no Part B deductible, and 100% of the 20% was paid. So my dad, historically over the years, went into the hospital a couple of times. One time he was in the hospital for several days with pneumonia. He had no cost, so he was paying the premium on the retirement benefit, and the retirement benefit paid almost 100% of the premium and the cost, but he had 100%, basically 100% coverage. So once that went away, he had what was called a special election period, which I'm going to explain exactly what that is in just a second and what happened with his situation moving forward. So when you lose credible coverage with an employer-based plan, you're going to have what's called as loss of coverage, and it's going to create a special election period. Typically, this happens in the fall of the year, and goes effective January 1st. My dad was notified in the fall of the year. Now, they had a third-party administrator enrolling the retirees into other Medicare health plans. The crazy thing is this third party had contracts that had higher premium costs for the Medicare supplement than just a standard Medicare supplement premium that we would look at for quotes. So at the time, my dad's premium, when I looked it up, I think it was like $140 or $160 a month. And that same insurance company with that third party was like $238 a month. And I was like, why is there a difference? And he said, well, the coverage is better. I said, dude, it's a plan F. A plan F on this plan and a plan F on this plan is exactly the same. It is not any better. And the guy I was dealing with was a complete imbecile and didn't know what he was talking about and wanted to argue with me. So I just said, okay, thanks for helping. I'll talk to you later. And got off the phone. So what did I do with my dad who lost credible coverage? Well, great question. I'm glad you asked. And this is what happened. He had Medicare Part A and Part B. He had a special enrollment period because of a loss of credible coverage, which allowed him a guaranteed issue. He had health situations going on and allowed him a guaranteed issue to enroll into a Medicare supplement. So I put him on another Medicare Supplement Plan F. Why did I do that? One, he's my dad. Two, he was used to a coverage being exactly a certain way, and he could enroll in the Medicare Supplement without any underwriting questions. Now, here's the sad thing. Catamaran that was covering his drugs went away. I had to put him in a standardized Part D plan. Then he was subject to $40 or $45 copays every month for his 3 medications. So his cost for coverage went up, and if you're losing a retirement plan, you're going to have only original Medicare, but you're going to have a special window set up to 63 days of loss of coverage. So if you do this in the fall of the year, from January for 63 days, you have to enroll into a drug plan because you're going to get a drug penalty, and you have those days in this window, and there's a couple of different scenarios. I'm not going to go through all of them. If you're in this scenario and you're losing coverage from a retirement benefit, you need to get with a licensed professional like us to guide you through exactly what is the rule that applies to you, what's the situation. And then here's a great thing. You may have been on a retirement plan. This happens all the time. People will call and say, I'm paying $400, $500, $600 a month for my retirement plan. I work for it. And I go, yeah, you're entitled to it because you work for it and you're paying for it as well. So you work for it, but you're paying for it. Did you realize that you can actually drop that coverage, go to a Medicare supplement or a Medicare Advantage plan and have much lower premium costs, and the out-of-pocket risk is much better than your employer-based plan. Most employer-based plans have a deductible, co-insurance, higher costs, and the max out-of-pockets are much higher. Then on original Medicare and a Medicare supplement, they pay a smaller premium, and it almost has 100% coverage, or a Medicare Advantage plan that has a max out-of-pocket much lower than the employer-based plan, and the access to care has no deductible typically for medical and hospitalization. So my suggestion to you is what? If you have a retirement plan that is going away and you're unsure of exactly what your options are, you need to schedule a time with professionals like us, and you can click below to schedule a time or call the number below as well. And then you need to understand, like, what are my options? I'm going back to just original Medicare. What does that expose me to? A lot of money. What are my options to enroll, and what is best for you? What's best for you is not what's best for your friend, your situation down the street, somebody you go out to dinner with. Their situation is different. You need to review based on your situation of your doctors, your medication, your plan, your access to care. If you live in a rural area, a metro area, do you have access to doctors, hospitals, and not? Having a professional walk you through and making sure you enroll into the right plan is so important if you are losing a retirement plan. And guys, I will say this, a lot of times how retirement plans are now, losing a retirement plan may have wakened you up to your options of you could have dropped that and had much better coverage at a lot lower cost. Retirement plans are not what they used to be historically unless you're with the state or federal government, and then also some other nuances. If you have additional questions, take the time, schedule below. We'd love to be able to walk you through and make your life easy by making Medicare simple. Until next time, I'll see you on the other side.